Hi, I'm Allie.
And I'm Becky.
We are registered dietitians that are passionate about functional approaches to whole body health.
In this video, we are talking about perimenopause, what it is, symptoms to look for, some of the common medications that might be prescribed to offset the symptoms of perimenopause, and what we would do instead from a functional medicine perspective.
Yes, so perimenopause, as the word sounds, means around menopause. This can be an 8 to 10 year window prior to an actual year without a menstrual cycle, which is how we would diagnose menopause. During perimenopause, a woman's sexual hormone production starts to slow down. This may be more accelerated at an earlier age in high-stressed individuals because that woman's body is focused on survival versus reproductive health. In this sense, they're putting out more corticosteroids or cortisol, and they're reducing that ovarian production at an earlier age. Perimenopause can happen in our mid-30s as well, all the way through our 40s, and again, can be this trickle or slowing down of hormone production lasting an 8 to 10 year span. During this period of time, you still may be able to conceive and experience fertility, but infertility can definitely be one of the primary concerns. We can also see some of the symptoms associated with menopause already starting to rear their head during the perimenopause window.
Yes, so I think one of the first symptoms that we'll often see, and this could be in a 35, 37-year-old, maybe it's after a woman has had her second or third child, that her cycle has just never really returned to normal. Maybe she's starting to see heavier or lighter menstrual flow than she's used to. Maybe she's spotting in between cycles or just seeing dynamic changes in her period.
We can also see during perimenopause weight gain as those estrogen levels are recalibrating because we can see women go from high estrogen to low estrogen. We can also see belly fat with that weight gain associated as our adipocytes or our fat cells are estrogenic. So it's like the body's trying to hold on, and we might experience some really stubborn metabolism.
We might see hair changes such as thinning or hair loss. We also might see irregular heartbeat or heart palpitations actually as a symptom of perimenopause as well.
We can see frequent headaches or severe migraines. We can also see an onset of more mental health concerns, an influx of anxiety, depression, and even impact of panic attack in individuals that did not prior experience these symptoms.
We can also see loss of sex drive. We can see difficulty with concentration and focus and just more brain fog, forgetfulness all of a sudden as another symptom.
And then finally, in the world of sexual hormone, we can also see breast tenderness or changes in breast tissue, either getting more fibrocystic or dense or more tender in that luteal phase premenstrual cycle.
We can also see an increase in UTIs, and we can start to see night sweats or big fluctuations in body temperature during this time.
So when this starts to occur in a woman and they go to their OBGYN or their general practitioner, a whole slew of medications can often be prescribed. We can see estrogen replacement medications or synthetic hormone being used. We often even are seeing now over the last couple of years birth control being prescribed to women, even though they might be past that peak or even at risk of fertility. And that synthetic hormone can really put the ovaries in a shutdown or a dormant mode, which could actually exacerbate some of these symptoms. We can see vaginal creams being prescribed for vaginal dryness. We can see anxiolytic or anxiety-reducing medications or antidepressants from SSRIs to Xanax. And we can even see medications prescribed for migraines.
Yeah, we might throw in there even an antibiotic if we're experiencing those UTIs, right? And I'll note on the estrogens, a lot of times estrogen is prescribed with no thought to progesterone support, which oftentimes will decline first and be more of the culprit of a lot of these symptoms. So we really want to focus on supporting the body in hormone production, making this more of a gentle decline than a sharp drop off the cliff.
Yes, so looking at using nutrients of focus that the body demands at higher need during these transitional times is the best place to start. The number one formula to start with would be our relax and regulate. This is because the magnesium bisglycinate in there can actually work as a neuromuscular relaxer, reducing not only day-to-day tension that we experience, maybe locking in our jaw or tightness in the neck or shoulders, but that release in the body sends a signal to the brain that it is safe. And instead of continuing to stimulate cortisol and suppressing hormone, we actually get better ovarian function. We see with the other powerful ingredient in our relax and regulate myo-inositol, significant support on a signaling level for women's hormone balance. This also can support insulin sensitivity for better blood sugar regulation and can aid in the FSH and LH, or follicular stimulating hormone, and luteal hormone levels to support hormone production when it's at time of decline.
Next up, I would look at a quality vitamin C supplement such as our BioC Plus, because vitamin C actually can support progesterone production. We're looking at, in this study, a 750 milligram dose, increasing progesterone levels up to 77%, which is really dynamic.
The third supplement that I would consider is our Women's Flora Probiotic. This is going to optimize vaginal health. So as hormones decline, the vaginal pH also changes. And this is what makes women more susceptible to those UTIs or BV or undesirable changes in discharge or lubrication. Our Women's Flora Probiotic contains Lactobacillus reuteri and Rhamnosus, the two strains that have been shown in clinical trials to actually prevent as well as treat UTIs, yeast infections, and support favorable vaginal conditions.
Okay, so maybe we're in that age range that we talked about. Maybe we're experiencing some of these symptoms, but how do we know for sure that we're in this perimenopausal phase?
So the most affordable test that you can do is going to be a day 3 hormone test during your active menstrual cycle. You're going to run your FSH and your LH, so your follicular stimulating hormone and your luteinizing hormone. You also would want to run an estradiol, progesterone, free testosterone, and total testosterone for just a good overall assessment of hormone. This should be able to be ordered at your general practitioner or your OBGYN. We will see FSH and LH levels increase when we're in this perimenopausal mode, and then there will be diagnostic ranges of menopause, which will be further diagnosed once you go an entire 12 months or 1 year absent of a menstrual cycle. Now, this isn't really unpacking though what's going on a root cause, and really if we're looking at maybe not anti-aging, but aging as gracefully as possible, we really want to understand more to the story in our sex hormones, especially in that stress connection. So we're going to link for you 2 functional medicine labs that we run at the Naturally Nourished Clinic that you can actually order direct, and that would come with a customized lab review by a functional medicine practitioner. This would be either the Labrix Neurohormone Complete Plus panel, which looks at a salivary assessment of a 4-point cortisol, DHEA, another marker of the adrenal glands and that stress story, as well as 3 types of estrogen, progesterone, and testosterone. And this panel would be more appropriate for those dealing with the insomnia, the mood disturbances, or the cognitive decline, because we also will look at your neurotransmitters such as serotonin, GABA, norepinephrine, epinephrine, and dopamine, to name some of them. Now, the other panel that we would run is our Dutch panel. The Dutch panel is going to look at a urinary hormone assessment in combination with saliva, and this will tell us more about our hormone metabolites. If you have a risk in the family history of estrogen-related cancers, or you're really looking to dig deeper into fertility, this would be more of a detailed dive on hormones and how they're working and being cleared from your body.
If you're curious to dive in a little bit more about blood versus urine versus saliva testing, you want to do an advanced hormone panel, but you're not sure which one, this podcast here is a really great deep dive into all of the modalities of hormone testing and when you'd want to consider them.
Yes. So ladies, it's not about anti-aging. It's about aging gracefully. And if you're feeling like there's something going on with your body and your body's trying to speak to you, but you're not getting the information, consider checking out the labs linked below. Also, be sure that you like this video and subscribe to the Naturally Nourished YouTube channel so you don't miss out on our bi-weekly releases. And next week, we're gonna be talking all about food as medicine for perimenopause.
Vagina.
Vagina.
If your vagina isn't working.
What do you think?